Many seniors lose teeth due to gum disease and getting implants. Will the gum disease cause the implants to loosen and eventually fall out? The answer is absolutely. Think about that. So the follower already mentioned that many seniors, are they aware that many seniors lose their teeth because of the gum disease. So the gum disease happens for a variety of reasons. Either it is because they don't have a good oral hygiene practice, they don't brush or floss their teeth properly, or it is possible the reason the access to the dental care, they are not following through with their dental treatment, with going back on to the dentist for a regular basis for a professional dental appointment. So if you have lost your teeth because of the poor or lack of dental care or poor oral hygiene, and the same gum disease that happens can happen around the dental implants also. This is what I tell my patients all the time. Dental implants are great, and they are metal, they are made of metal. The great thing about the dental implants is they look, feel, and function like a natural teeth. Great thing again, they don't get any cavities because they are metal. They don't get any root canal because they are metal, but they can get some gum disease around them because you cannot control the gum disease and they are not foolproof. So you will get some gum disease around them, and again, if you don't take care of the implant properly, you will end up losing the implant, particularly from the gum disease. And I hope this answers your question.